Thyroid conditions are very common in Canada. In my practice, I've seen a number of thyroid issues, from hypothyroid, which is low thyroid function, to hyperthyroid, which is high thyroid function. Also autoimmune diseases like Hashimoto's, Graves' disease, and also conditions like Wilson temperature syndrome I've all come across in my patient base. In Canada, Synthroid, the drug levothyroxine, is the most prescribed drug to Canadians. So thyroid conditions are very common. Now, to know if you have a thyroid condition, I normally like to do some blood work on patients. So this blood work could either come from your family doctor, or I could order it for you. Things I like to see are TSH, so thyroid stimulating hormone, hormone T4, hormone T3, and reverse T3. So this will give me a nice complete view of what's going on with your thyroid. Another thing I like to look at too is something called a basal body temperature, so the BBT. So this is where we check your temperature, or you check your temperature on a daily basis at 3 hours increments, and I have a separate video which explains how to do that. And if you do have thyroid, we have a lot of different treatment options. There's some supplements we could do to help with your conversion of T4 to T3 if you are hypo. And in some cases, you may be a candidate for desiccated thyroid. So desiccated thyroid is a mix of hormone T3 and a mix of hormone T4. So it is a prescription medication. I could write you a prescription for this if it's appropriate. And I find that gives patients a slightly more balanced hormone distribution of T4 and T3. Now, if you're watching this, you're probably wondering, well, how do I know if I have a thyroid condition? Pretty fair question. Common symptoms you'll see if you have low thyroid, which is the most common thyroid condition, would be weight gain and trouble losing weight, fatigue, constipation, dry skin, hair thinning, period issues if you're a woman, and a bit of a flat mood. Sometimes people will feel like their mood is a little bit flat, and a lot of thyroid patients are usually chilly. So regardless of your thyroid condition, I could find a program that's specialized for you.